Right, hello, everybody. Hello. I'm so glad to see so many of you here today on this hot Tuesday morning.
Yeah, me too.
Thank you all for coming, and the coffee and pastries will be outside. Feel free during the event to go get some more as you wish. So welcome to the Wilson Center. Thank you for coming to A More Prosperous World, the role of population and family planning in economic growth, education, and health, and a special welcome to those of you watching live online. I'm Megan Parker. I'm the Senior Writer Editor and Partnerships Director for the Environmental Change and Security Program here at the Wilson Center. And I'm very pleased to be welcoming you today, which is the day before World Population Day, if you didn't know. So a few quick words about where you're sitting before we turn it over to our keynote speaker. The Wilson Center is the living formal memorial to President Woodrow Wilson, who is the only president to have a PhD. And here at the center, our mission is to bridge the gap between scholarship and policy in the world of international affairs. And we also seek to bridge the gaps between issues as well. So for almost 25 years, my program, the Environmental Change and Security Program, has championed an interdisciplinary approach to understanding how population dynamics and access to health care are connected to our sustainability, our prosperity, and our security. And this event is the final one in a three-part series that we've held over the last few months on population and family planning and their contribution to meeting global goals. So today we'll focus on the goals related to economic development, including economic growth, education, and health. In our prior events, if you missed them, you can watch them online. The first one was on security, and then the second one was on resilience, including food, water, and disaster response. Today, our panel of experts will discuss how population dynamics shapes development and the role of voluntary family planning in increasing opportunities for growth at all levels, from the personal household level to the national country level to the global. So this topic is probably, like many of you, near and dear to my heart as a woman and a mother whose education, health, and employment, in fact, my presence here today, was facilitated by family planning. I'd like to thank our partners at PRB's PACE project, which stands for Policy, Advocacy, Communication Enhanced for Population and Reproductive Health, for their support and assistance on this important series, and as well as for working with the Wilson Center for 2 decades on these critical issues. And I see Jeff is here from PRB. Thank you very much. Been great partners. Wonderful to work with. And thank you to our distinguished guest and keynote speaker, Peter McPherson. Peter is the president of the Association of Public and Land-Grant Universities, which is the nation's oldest higher education association and representing universities in all 50 states, the District of Columbia, 4 territories, Canada, and Mexico. That's a lot. Previously, McPherson served as president of Michigan State University, executive vice president for Bank of America, deputy secretary of the U.S. Treasury, and critically for today's discussion, the administrator of the U.S. Agency for International Development. After Peter speaks, we'll turn it over to our moderator, Joan Maurer, who's head of development at the Voice of America, the largest U.S. international broadcaster, where she oversees special broadcasting and training programs. Previously, she was the director of international programs at the Freedom Forum Museum, where she promoted press freedom, which we could all use. After the speakers give their brief presentations, we'll have a very productive Q&A. Start thinking now about your questions and make sure they are questions, not speeches. I've given Joan strict instructions to cut you off. We have a lot of people here, and I know everybody has great questions to ask. If you're watching online, please tweet your question to @NewSecurityBeat using the hashtag #ThePaceProject, or in honor of World Population Day, you can also use hashtag WPD2018. And those hashtags will appear on the screen as well. So I'd like to invite Peter to come up now.
Well, it's a delight to be here, to see so many of you that I know I've worked with previously. I've been asked to talk a little bit about the history, at least the history that I know so well. And then I know, and raise some questions, and I know this panel, who are now work on this issue all the time or think about it a lot, will go into some of those problems and questions. The AID early on led the world efforts. The U.S. with AID led the world efforts on family planning. We almost forget these decades ago what an important effort that was for our government, for our country. They were productive, but often quite controversial times. One of my mentors in this area is Sandy Levin, who was the assistant administrator for essentially family planning during the Carter years, a grand man actually, who's about to retire after many terms in Congress as a senior member of the Ways and Means Committee. I was administrator for most of the Reagan years, the 2 terms. I think of these times overall as very successful in terms of family planning. Our numbers, actually, the Reagan administration spent more dollars than all previous administrations combined did on family planning, a number that often people don't remember. But it was key because we continue to provide that international leadership. I think that, of course, that was also the time of the Mexico City policy. And some of us know a lot about how we worked around and through that, but that leadership remained. Family planning was certainly the most contentious issue of my tenure at AID, with some of the right thinking that IUDs were abortions and were destroying social structures in developing countries, and some of the left demanding that AID fund abortions. Early on, I concluded that family planning would be supported by President Reagan as long as AID did not fund support abortion as part of it. I got into this within weeks of my coming, within the first month of the administration. OMB Director David Stockman eliminated family planning as in the AID budget in his first budget within the administration. I called Chief of Staff Jim Baker. We all remember Jim Baker. He was then the Chief of Staff for Reagan, and said, if this is going to happen, I should probably go back and practice law. And he said, oh, Peter, don't worry. David just wants your money. He's not so concerned about the program. This is all a negotiation. Go back and fight it out. Well, we did. In fact, the budget remained, including family planning, pretty much the way it had been. With the final decisions, that first time around, Reagan actually entertained appeals. And so Stockman and I sat in front of him in the Oval Office and kind of bickered it out. Reagan didn't really ever get involved in it, but Stockman and I settled it. But it clearly was an indication to me that Reagan would be supportive. But the tensions issues certainly didn't stop. One day, President Reagan called and said, Peter, I just got off the phone with Mother Teresa, and here's her number to call her. You'll all appreciate this. I'm in my office at AID. The president calls, I stand up. So I called Mother Teresa. It's pretty hard to argue with a saint. Even then, she looked like she was probably going to be one. But she told me, it was a good discussion. There's more stories about Mother Teresa I've got, but no time here. A wonderful lady, and she was anxious that we support the unborn, was her words. The pressure came from Senator Helms and some others, however, that was very intense. In Guatemala, my mission director was doing as I wanted him to do, strongly supporting family planning. And the ambassador of the country was a friend of Helms and supportive of his policy. And the ambassador, as he had the authority to do, told my AID mission director to leave his position. So he came back home. Well, if I wasn't careful, we'd lose control of this whole thing. So I suppose to the consternation and cheers of some and cheers to others, I appointed him the director of the Central American AID programs. And that kind of put a little stop to that. But there was more. My assistant administrator for Africa started sending negative messages about family planning to the field. Senator Helms called me and told me that he was a great person and I should support him. And in fact, I was about to lose control of the family planning policy for all of Africa. I recall one Saturday morning sitting in my office and remembered a provision of the law by which I could move a Senate-confirmed assistant administrator to another assistant administrator position without anybody else being involved. I had one vacancy, frankly, happily. So I appointed an acting African assistant administrator and moved this other guy to the vacant position where he didn't have any people. Not everybody was happy about that, and Helms subsequently took that authority away in the law to do that. But it certainly confirmed that where we were, I mean, there were lots of struggles. I, of course, have more stories. But it wasn't just from Senator Helms and some others and I seemed to get along personally all right with Helms, but of course there were these intense issues. It wasn't just from Helms and others, but from the left as well. Principally International Planned Parenthood, then headed by Faye Weddington, who, frankly, I think we felt had some domestic concerns or issues that she had. I remember driving down the street on K Street one Thursday morning and looking up and seeing in the bus in front of me, the back of the bus in front of me, a huge sign saying, Administrator McPherson kills women. I mean, it was like this big, like that high. Well, clearly, Faye's theory was that by not supporting abortion, I was killing women. In those days, buses in Washington were ubiquitous, and for a couple of weeks, every bus seemed to have this big sign. What Weddington really didn't understand with those signs absolutely cemented my position in the White House. Reagan thought they were great. UNFPA was another big issue and a sad and troubled situation. I got conservative Jim Buckley, then Undersecretary of State, to announce with me that we would stay in UNFPA. But then information kept coming out that the UNFPA money was doing some work in connection with China's policy of one child per family. So what to do? Well, in the Oval Office, Reagan agreed that if all the money that UNFPA gave China went for child survival, then we could stay in UNFPA. Well, and I also thought that if we had to, he would have agreed that if all the money went to condoms, we could stay in UNFPA. Well, in the end, the Chinese were not willing to have money directed that went to China from UNFPA, and the U.S. withdrew, as some of you remember. This has been a back and forth matter. All this time, my AID staff were just, the family planning and frankly, the career staff generally, were just magnificent. Steve Sinding, Duff Gillespie, and many others. During those years, we kept the money and our leadership internationally. What's happened in the years since, and we'll be talking about that, was fertility rates, particularly in Latin America and Asia, broadly, there are pockets not true, broadly have fallen. They've fallen some in Africa. It's about 2.5% now, but not as much as we frankly might have expected given decreased child mortality, more girls in school, average higher income. There are pockets of deep poverty in Africa, but the numbers overall didn't respond quite as much as we thought. It's not the first time that happened. Urban Mexico's had family fertility rates fell much faster than rural Mexico. But this is an issue, and I know that our experts on this panel will get into this. There's lots of questions. In my mind, Africa and how we help and deal with this is of critical importance, and I'm certainly glad to be able to see all of you this morning. Thank you.
Thank you. Thank you so much, Peter, for that historical perspective. It's really wonderful to get your behind-the-scenes look at how that played out. And as you said, now we're going to turn and look at the future of family planning and population dynamics. I'm going to turn it over to Joan, who will introduce the panelists. But you have their full bios in your handouts. Thank you. Thank you, Joan.
Should I sit or stand? Does anyone care? I'll stand. Hi, Great to see everybody. Our first, and thank you very much for that overview, and also for framing the question that you put at the end. What's happened to Africa? So I hope we can get into more of that later on. Our first speaker is Marlene Lee, head of international programs at Population Reference Bureau. Is that right? You're at PRB?
I'm at PRB.
Okay.
I'm not the head of international programs.
Okay, it says international programs, but that's okay. We look forward to hearing you. Our speakers have 10 minutes each, and we're going to run a program where our speakers are going to go in order, have a discussion among themselves, and then open it up for a nice, robust discussion of over an hour. Go ahead, Marlene.
Great, thank you. My name is Marlene Lee. I'm a senior program director working under the head of international programs at PRB.
Promoted you.
Thank you. And I'm happy to be here today, courtesy of the USAID PACE project at PRB, which is a partner in this forum today. I have elected not to do PowerPoints today, so please, I will try to be clear and brief, and I'm sure that your visual needs will be fulfilled by the other panelists today. I was given essentially 3 questions to address. One of them is to define the demographic dividend for you. The second question is what allows some countries to achieve the demographic dividend while others do not, and what determines how much countries can capitalize on their demographic opportunity. I slightly modified that question. And then the final question is how does the demographic dividend help contribute to addressing inequality? So I will address those questions in order. I have 3 points that right up front I'd like to tell you that I think these are 3 important points that you need to remember about the demographic dividend. One, there's some dispute with Parfait, but I say the demographic dividend is a potential for economic growth. It's not automatic, and it's a result that we're trying to achieve. The second thing that I'd like you to remember as I speak is that labor productivity or human capital, that the skills, the knowledge that help increase productivity is also not automatic. We don't arrive, ready workers, cloned and imprinted. We need some investment to be the most productive in the environment that we're in. And the third piece, which I actually think, it wasn't until 2 weeks ago that the light bulb went off in my head, even though it was there from day one when Bloom and Canning started to talk about the demographic dividend. The change in age structure that is kind of the propeller for the demographic dividend creates, I'm going to use a term I just learned, fiscal space for investment. And I'm going to define that for you as I go along. So let's get back to Africa and world population growth, since that's where we left off with the last speaker. I think Africa is a very interesting case for us right now. Steady declines in fertility in Latin America and Asian countries have really been the drivers of declining world population growth since the 1960s. But as Peter said, sub-Saharan Africa's population growth has remained above 2% per year and will likely remain at that level beyond 2030. So this means that sub-Saharan Africa is still in a period of rapidly growing youth cohorts. And the difference between sub-Saharan Africa and Asia and Latin America in terms of growth rate is reflected in the growth of their working age population. So sub-Saharan Africa has a working age population that will continue to grow rapidly, and that will actually rise to numbers that are similar to the numbers of working age population in China and India today. So when you encounter development colleagues from African countries that are thinking regionally, and they say they want to be the next China, there is grounding in the way their population is growing. And theories of economic change, some dynamic explanations actually are based on the fact that population increases can drive national growth. The basic argument, though, is around employed workers. It's not around just any population growth. I should say that since we're here about family planning today. And the idea is that employed workers produce more goods and services, and as long as there are folks to buy those goods and services, and there's not something drastic that happens that produces a decline in worker productivity, you'll see economic growth at the national level. In sub-Saharan Africa, the way you're getting growth in the labor force or the working age population is from people aging into the workforce, this young cohort coming of age. And economist David Lamb has estimated that sub-Saharan Africa will need to generate 1 million new jobs per month just to keep employment rates stable. And it will need to generate about $2 million new jobs per month by 2030. So the rapid growth in sub-Saharan Africa's workforce will put pressure on labor markets, particularly rural labor markets, where there may be few new employment opportunities. So I'm going to segue from that into the demographic dividend. You have this large opportunity, which is a growing working age population, and the demographic dividend actually points out that even in a resource-constrained environment, accelerated economic growth is possible when the distribution of the population across age groups changes. So if you were just having population growth and the size of the working age population relative to other age groups didn't change, you might not see this accelerated growth. But we're talking about a change in the distribution across age groups where, from our perspective here, what we consider ages 15 to 64 would be working age group, where that group is growing faster than younger and older groups. So it's that population pyramid that you've seen with the bulge in the middle. And this shift in age structure produces an opportunity for economic growth because of the potential labor productivity of this group. I talked about creating fiscal space. The change in age structure can create fiscal space if you have a smaller, younger group behind those working age folks. Initial investments in reducing child mortality may be very high, and when there are high fertility rates, you'll have to keep investing at a high rate in the health of children under 5. But if fertility rates decline and you have the same level of intervention, then you'll be spending less on the children under 5. And that's what we're talking about, creating fiscal space. You will be able to find some potential savings in a budget and take into consideration what your long-term goals are for spending. Should we not spend on health? No, because you need a healthy workforce. Maybe savings that are gained on the under 5 age group needs to be spent on the health of those in secondary school so that they can pay more attention in class and acquire the skills they need. So there is this idea that the dynamics of the age structure change creates some areas where you can spend less and some areas where there's potential to spend more. And really, I'm getting into the question now about what allows some countries to achieve a demographic dividend while others do not, and what determines how much countries can capitalize on their demographic opportunity. So Bloom and Canning talked about a virtuous cycle that connects health and the labor force. The labor supply is actually an output in the economic terms of both fertility, health, and education. And if you want to read more about that type of model, there was in PDR, Population Development Review, in January 2017, Kara, Canning, and Wild have a nice diagram about how these pieces fit in. So in effect, the working age population is not automatically ready to work in the most productive jobs that would help grow the economy. And this cycle that connects health to labor force productivity and employment is starts with pregnant women. Their health affects the potential of their children. Children's health affects their ability to pay attention in school. Young workers' health affects their physical and cognitive abilities. The availability of health services and access to treatment, preventative treatment, is crucial at all ages. South Korea greatly improved health indicators to among the world's highest by investing in healthcare providers and facilities, as well as expanding access to healthcare through government-sponsored insurance programs. In Latin America, the health situation is a little bit more complex. I went to a continent, so yes, but you still have communicable disease for the poor, and you have emerging chronic and non-communicable diseases. So you have rich or upper middle class countries like Chile, Costa Rica, and Cuba that have lowered infant mortality rates, but other countries like Bolivia, Guatemala, and Haiti that still have pretty high infant mortality rates. So that region of the world did not benefit as much from their changing demographics. Now, Africa has improving health indicators, but a weak health system. So in order to benefit from this growing youth or young working age population, an improved health system is critical to meeting the needs that will keep workers healthy and available for better jobs as we create them. Education is another key component, and South Korea changed their compulsory primary education so that it was more production-oriented. Again, they had a more planned economy where they were thinking of what would be needed to take advantage of this growing workforce. In general, there's this issue about what's a macroeconomic enabling environment, and that's very context-specific. I won't really go into that much, but during its time of demographic and economic transition, South Korea had comprehensive development plans over several decades. This included protecting fledgling industries, but there was a timeline for phasing out protection of those industries. And it was very open. Again, we're back to this idea of fiscal space, looking at your long-term goals, where you're going to have savings, and where you want to spend money in order to take advantage of the potential that this young working age population can add to your economy. Issues of corruption and good governance. If you're working on a plan and you think you're getting a certain amount of money in and you want to spend a certain amount of money on particular activities, social, physical infrastructure, then it's important to know that money is not being siphoned off, or at least a lot of money is not being siphoned off, and to have the governance in place to put a check on this. So finally, getting to how does the demographic dividend contribute to addressing inequality? That is also not automatic. India has potential for a very large and very high demographic dividend. All the estimates are pretty big, but that doesn't take into account that the labor force participation rates of women in India are much lower than what you saw when the Asian tigers went through their demographic dividend period. And inequality in itself will limit the size of a demographic dividend. So in order to address inequality, you've got to have targeted investments, gender-aware policies, and really pay attention to bringing along the most disadvantaged people in terms of reducing fertility, improving school enrollment, and their health. So, thank you.
Thank you, Marlene, for really framing the questions, and I'm sure we'll get into that in our Q&A. All right, let's see. Jay Gribble's our next speaker. Let me see if I can promote him. He's a senior fellow and deputy director at the Health Policy Plus Project. Jay's very active in this field, has been for 30 years. So, Jay, take it away.
Thanks, Joan. It's a pleasure to be here this morning. Before starting, I want to acknowledge my colleagues Kaya Yurchenska and Susie Sacker, who have led the development of the model that I'm going to be talking about today. Let's see if I can get this right. Okay. So what I'm going to be talking about is a model that we've developed under the Health Policy Plus project that really looks at the relationship between family planning investments and how they can help countries move toward achieving their sustainable development goals. Ensuring healthy lives and promoting well-being for all is an essential element of the SDGs, and within this is the target of achieving universal access to sexual and reproductive health care services, including family planning information, education, and services. Family planning is one of the smartest SDG priorities with broad social, economic, and environmental benefits. For example, we know that for each additional dollar invested in family planning, the health system saves $2.20 on pregnancy-related care. The cost of preventing an unintended pregnancy through family planning is much lower than the cost of providing pregnancy and maternity care. And fully addressing the unmet need for family planning would reduce the number of maternal deaths by about 76,000 per year. The benefits of family planning are well documented, but given the breadth of the SDGs, it can make it difficult for countries to prioritize and implement development programs. Stakeholders often lack local evidence on the extent to which investing in family planning can help them achieve the SDGs. But quantifying these relationships will help increase investments in cost-effective interventions. So to help address this situation, the Health Policy Plus project, supported by the U.S. Agency for International Development, has developed the Family Planning Sustainable Development Goals model. It allows users to estimate the effect of family planning on several SDG indicators through 2030 or beyond to 2050. In short, the model quantifies the boost that family planning offers toward realizing the SDGs. And like the models that are developed under this project, they're free, based in Excel, have default databases, have flexible starting and end dates for projections, and produce results that are presented in graphs and tables for easy export and presentation. The model works by projecting the medium and long-term impacts of different levels of family planning use on the SDGs, while taking into account the effect of other policy variables. We do this first by quantifying the impact of family planning on future population age structures. We do population projections using the DEMPROJ model of the Spectrum suite of models. Then those population projections interact with statistically derived equations to quantify the boost of family planning for the 13 SDG indicators. We estimate these relationships using ordinary least squares estimates and structural equation modeling, and the statistical testing was cross-sectional and multi-country. And the results can be used to generate broad-based support for a number of areas, to increase financial investment in family planning programs, for revising or updating family planning policies and strategies and bolstering their implementation, building political will for supporting family planning, and finally, for integrating family planning components into policies and strategies of other sectors. So here we see the goal areas and the specific indicators that we've identified that have a relationship between family planning and SDGs. We've identified 13 SDG indicators and 7 goal areas. Let's look at 3 areas of the model outputs that pertain to today's session: health, education, and economic growth, and consider how population dynamics contribute to each of these areas of the model. Let's start with health, specifically averting maternal deaths. We know that population dynamics have both a direct and indirect effect. There's strong evidence that fertility matters on maternal survival. Pregnancies resulting in life-threatening complications are more likely to occur at maternal ages that are too young or too old, pregnancies that are spaced too closely, and at high parities. So family planning can help prevent these high-risk pregnancies. For education, specifically for learning outcomes, we know that family size affects parents' investments in the human capital of their children. The larger the family size, the lower the investment in child education generally, which is related then to lower quality of education and lower achievement in school. Adolescent childbearing also has negative implications for the cognitive and educational development of the mother and the child. Firstborn children of adolescent mothers score lower on some intelligence tests early in life, as well as have lower school attendance and achievements in reading and arithmetic. Then poverty reduction, specifically the proportion of the population below the international poverty line. Demographic factors, including total fertility rate, are linked to increased poverty through several mechanisms. One way is that high fertility can reduce the ability of poor households to achieve a given level of consumption. An additional way is that with higher fertility, there is a higher dependency ratio, like what Marlene was talking about with the demographic dividend, which can dilute per capita consumption, and more so in the poorer households. So in other words, higher fertility may worsen the distribution of consumption if the extra births are concentrated in poorer households. Therefore, as a key driver of fertility levels, family planning use directly reduces the risks of maternal death, increases the chances of higher educational achievement, and reduces the share of people below the poverty line. Now, it's important to note that demographic variables aren't the only predictors in these outcomes. We included other independent variables identified through extensive literature review in the model. So let's take a look at the results of an application. And here we see what we did when we applied the model last year in Malawi. We calibrated the model from starting in 2015 and going to 2050. And we created 3 scenarios that you see. First scenario, MCPR, modern contraceptive prevalence rate, stalls at 45% through 2050, the end of the projection date. Scenario 2 is tied to achieving the FP 2020 goal, where 60% of women are using modern contraception, and then we assume that it stalls from 2020 to 2050. And then scenario 3, we call the FP 2020 goal plus, and that's where they achieved their FP 2020 goal, but continue to increase MCPR slowly so that by 2050, they've got a contraceptive prevalence rate of 68%. Also, what we do in these assumptions is say that the other socioeconomic factors are held constant. So what we're looking at is really the effect of family planning and population age structure on these outcomes. So first of all, looking at SDG 1, reducing poverty, we see that in these bars, the number of people in millions that would be living under the poverty line by 2050. And in the baseline, where contraceptive prevalence stalls, Malawi would have about 12 million people by 2050. And under the most optimal family planning scenario, that number drops to just over 9 million below the poverty line. So if Malawi expands family planning activities over time, the country's share of population in poverty will decline by 39% today to 30% in 2050, meaning that millions fewer Malawians will be living under the poverty line compared to the scenario where the FP 2020 goals are not reached. Second area is SDG 3 related to health, and here we look at improving the health of mothers, specifically the maternal mortality ratio in 2050. We know that through helping reduce the number of high-risk pregnancies, we save mothers' lives. And here we see a really significant increase under the base scenario of flattening out MCPR. We would see a maternal mortality ratio of 388 deaths per 100,000 births. Under the optimal scenario, we see that drops almost in half to 199. So the number of women dying could decrease dramatically if Malawi amplifies its activities through 2050. And finally, education, SDG 4. When families are smaller, achieved through family planning, parents can invest more in each child, including that area of education. Here we see looking at proficiency in reading. In 2050, under the base scenario, 61% of children are proficient in reading. Under the best family planning scenario, it's up to almost 77%. So by 2050, if Malawi could experience an increase in contraceptive prevalence compared to the no family planning 2020 scenario, the proportion of children at the end of primary school who achieved at least a minimum proficiency in reading would significantly increase. So these are just a few examples of some of the indicators that we've identified, really demonstrating this relationship between family planning and achieving the SDGs. I think that there are lots more that we could look at, and we've applied it in Malawi. We will be applying the model in Mali, Tanzania, and then an application for the Ouagadougou partnership countries. So look forward to getting this out there and helping countries focus more on the SDGs and using family planning as a way to help them get that boost toward achieving the goals. Thank you.
Great, thank you, Jay. Taking metrics to a whole new level here, so I hope we can really drill down in our discussion. All right, next is Jocelyn, where are you? Trying to promote you too. Jocelyn Aldridge is Senior Director of Global Policy and External Affairs at EMD Serena, correct? The Biopharmaceuticals Division of Merck KGaA. I'll let everybody read your bio and look forward to hearing what you have to say. Are you PowerPointing?
Yes.
Okay, so are you,
Yep,
have your
they're up.
clicker? You're
They're
good?
up, ready,
Okay.
Yep. Okay. Hi, everyone. Jocelyn Ulrich is my name, and EMD Serono is the U.S. and Canadian biopharma business of Merck KGaA Darmstadt, Germany. Not to be confused with Merck & Co. Merck KGaA Darmstadt, Germany is actually the world's oldest pharmaceutical company. We've been in existence for 350 years and are still 70% family owned. So that has a lot to do with why we are involved in this public-private partnership, and I'll explain more about that as we move on. So today I would like to just introduce everyone to a public-private initiative called Healthy Women, Healthy Economies. There is a pillar within that partnership that is based on sexual and reproductive health and based a lot on the literature and the data that has already been spoken about this morning. And then briefly, I'll discuss why EMD Serono and Merck KGaA Darmstadt, Germany are committed to this initiative and what we are hoping to drive and implement as a private sector company. Okay. So I think as everyone has already gone over, the economic case for investing in women's health is quite clear. Sustainable economic growth really can't be achieved if we're leaving half the population behind. And we know that there are significant barriers to women's health across many areas that are preventing them from fully participating in their economies. Everything from non-communicable diseases, to the dual burden of work, women who are managing caregiving responsibilities for both children and elderly parents while also trying to manage work-life integration and other diseases that are impacting women disproportionately around the world. So Healthy Women, Healthy Economies is a global initiative that aims to unleash the economic power of women by bringing governments, private sector, and other civil sector actors together in an effort to improve women's health and by extension their families so they can join, thrive, and rise, bringing prosperity home to their families and communities. So this partnership was established in 2014 within APEC. Those economies came together at that time. Merck KGaA Darmstadt, Germany is the founding private sector partner, but this work was initially led by the US government as well as the government of Philippines and other APEC economies. That gathering, after a literature review and a kind of identification of the key areas in which health barriers were preventing women's economic prosperity, led to a comprehensive literature review and a policy toolkit. And I'll talk a little bit about some of the findings from those efforts. And then since 2015, we've been holding implementation workshops to track progress against those policy goals, where different economies have highlighted the implementation and the aspects of the policy toolkit that they have taken up. They're very much in line with the SDG goals, so there's been clear links that some of the economies have been able to speak to. The unique opportunity within APEC is that it does have the opportunity to bring parts of the governments who are actively making decisions around investment, like ministers of finance, ministers of health, with private sector to have discussions about investment in healthcare and investment in family planning and other things. So when that working group, the expert group, came together in 2004 in Beijing, there was the APEC Human Resource Development Working Group, the Policy Partnership on Women and the Economy, and there was a robust discussion about what are the 5 broad areas that are really impacting women's ability to participate more fully. And these were the 5 areas that they identified: workplace health and safety, health access and awareness, which covers a lot of the screening and treatment programs around NCDs and also communicable diseases, reproductive and sexual health, gender violence and sexual harassment, and policies around work-life balance and integration. So I'll provide a little bit of the literature review that exists in the documents on the APEC Healthy Women, Healthy Economies website. As I said, there was this comprehensive exercise to look at the literature at the time. This was released in 2015, so data has been, of course, updated, but here are some of the examples that have already been highlighted by other speakers. Just discussing the impact on women's prosperity when they have access to adequate reproductive and sexual health support services in different economies. And within the spirit of APEC, they looked at both more developed and lesser developed economies to see some comparison around how much intervention could make a difference. We've seen both the U.S. story about higher income achievement in women who are able to delay childbearing versus in Chile having babies young and the implications for them on their ability to complete school, and then all of the other secondary effects that have already been spoken about. From a policy recommendation perspective, in the policy toolkit, this is a summary of the recommendations under the sexual and reproductive health section of the toolkit. There were 4 broad areas that were recommended by the expert panel. First, improving access to sexual and reproductive health services, both from workplace policies to support women, developing policies to increase access for the vulnerably employed, those who are part-time or otherwise employed, and reducing financial barriers to accessing those services. And within the policy toolkit, I'll provide the links in this presentation for you to go on the website and see. It also makes a recommendation for whether these are actions that could be taken by private sector, governments, or both. So you can see that workplace policies are something that private sector would be taking on versus some of the other broader policies that are more government-related. Second, increasing awareness of services for voluntary family planning with recommendations to develop comprehensive programs, develop broad-based education, expanding programs to non-traditional settings, and educating beneficiaries about available health services and their insurance programs. Third, providing high-quality maternal, sexual, and reproductive services broadly, including strengthening healthcare worker training, accreditation and licensing for healthcare workers, standards and client satisfaction tools so that economies can get feedback from how well these programs are working for the communities in which we are introducing these programs. And then fourth, protecting against discrimination. So assessing the policy environments that protect women from discrimination and developing policies and trainings that support non-discrimination. So I mentioned on the APEC website there are a suite of tools and resources, as well as a page on the Merck KGaA Darmstadt Germany webpage, which talks about our more specific commitment. But there you'll see the toolkit and the literature review. Also, a monitoring and evaluation framework was developed in partnership with the U.S. government and others. Economic and business cases to help make the case for policymakers in particular on investing in these programs. And then coming out of every implementation workshop are the outcome reports and case studies demonstrating economies' contributions and progress against the toolkit objectives. So a little bit more about why Merck KGaA Darmstadt Germany founded this initiative with APEC governments and what we are doing. As I mentioned, it's a 350-year-old company where we feel that the importance of family is firmly rooted within that history. A family-owned company, very long-standing. And this is part of our ongoing commitment to focus on caring for patients and their families. We also are a provider of solutions for diseases that disproportionately impact women, including thyroid, MS, and we also are a leading fertility provider. So we believe in investing in initiatives to improve major aspects of women and health, from increasing access to education and government programs. We also believe that part of our commitment within the Healthy Women, Healthy Economies is to help drive awareness of this public-private partnership and the policy recommendations. And so that's part of the benefit of being here today to talk to all of you, is we want to make sure that people are aware that these resources are available. And so we have, as a company, have really adopted this core mission and are expanding upon it by putting our commitment through 3 primary areas. We're supporting research to help quantify this link between women's health and economic prosperity. We've been working with some leading academic researchers, as well as establishing a Center for Social Science Research with the March of Dimes and others, and forming meaningful collaborations to advocate for change, including with the Wilson Center. and then living the mission by bringing this to our own employees. We've been committed to looking at workplace parity. We have a Women in Leadership Task Force that's looking at workplace policies, work-life integration, supporting people within our company that are caregivers, providing resources, et cetera. So we're making sure that we can walk the talk internally as well as talking about this externally. 3 policy areas that we are focused on. Given our deep experience in non-communicable diseases, health access and awareness is a key pillar, and mainly around thyroid, MS, and others, as I mentioned. Work-life integration, extremely important. We really believe that there are severe detriments to women's health, especially in developed markets, trying to balance workplace responsibilities and caregiving responsibilities, and this is a major driver of stress and negative health outcomes for women. And that we really are all responsible for equitable workplaces. So implementation to date, we have brought the toolkit to other fora outside of APEC. We have launched some reports quantifying the socioeconomic impact of diseases such as oncology and MS with other partners. We have highlighted this at Women Deliver coming up next year in Canada and formerly in Denmark. We have worked with women political leaders to put this on their annual Global Forum agenda. And we'll continue to establish public-private partnerships around diseases that are disproportionately impacting women, such as thyroid in the Philippines. That is it.
Great. Thank you, Jocelyn. I have to profess I knew nothing about this, so this is really exciting, and I hope we'll have a lot of questions. Okay, last but not least, Parfait, are you with us?
Absolutely.
Oh, wow, you're coming in loud and clear, and I know you won't be doing a PowerPoint, but anyway, I'm going to not butcher your name, I hope. Parfait Elandu Eganye. Am I close? Is professor at the Department of Development Sociology at Cornell. So with us from Skype, and take it away, Parfait.
Yeah, I actually was hoping to do a PowerPoint with Ben serving as my pointer. So I don't know
We
if
have
it's
your
ready
PowerPoint
there.
up.
Wow, great, Ben. Modern technology.
We are ready for your PowerPoint. We're good to go.
Okay, perfect. So I'm really glad to join you. I wish I were there in person. And I'm also glad to be the last person coming in. You know, it's just a great person to be the last to speak, because on the one hand, you can riff off everybody else and say just, you know, I also thought the same thing, you know, just take all their good ideas and make them yours. But I won't do that. You could also decide to play cleanup crew and basically try to see what was left off. But I think all the presenters covered most of the bases, so I really don't have anything to clean up. And so the only task that is possible for me would be to try to tie all this together, try somehow to bring all of this conversation to sort of a synthetic close. And so that's what I'm going to do. I'm going to try to give you some kind of bottom line understanding of where I think we stand in the debates on how family planning can or has contributed to the goals of equal and sustainable development. And so I have to acknowledge that in addition to the difficulty with technology, I face sort of one basic challenge that I find hard to resolve. As I was thinking about these remarks, I thought I was placed in a position of someone who has to speak to the choir, not even the choir, to the conductors of a choir. Everybody in this room, and certainly the panelists, have read, heard, or even written about every single thing I can say here today. So instead of trying to preach to the choir, I decided to do something else. I tried to invite the choir to reflect on how it is heard from the pew. That is, how together, how can the collective choir that we represent here today craft a message that is both accurate, but also relevant to people who are supposed to listen to this message. And so my main thesis is that one way in which we get at this kind of messages is basically moving from what I call a laundry list to a bottom line. And so I can't see the PowerPoint, but I would just sort of ask Ben to move to the next slide. So let me try to say what I mean by this, just moving the tagline, which is moving from the laundry list to the bottom line. What I have to say, if I can summarize the point that I'm trying to make there, holds in 3 points. The first point is that a lot of the advocacy of family planning has been built around establishing long lists of the many ways in which family planning can be relevant. And there's a lot of good about laundry lists, and I'm going to discuss some of these laundry lists. But at the same time, laundry lists can become a problem if they're not clear, synthetic, and integrative. And so what I suggest is that we think more and more about bottom lines. And I suggest 4 bottom lines that actually also correspond to 4 strategic audiences that we may want to reach. The first bottom line is what I would call a financial bottom line. And I think 2 of the speakers have already addressed this bottom line. A second bottom line is what I may call the equity bottom line. Next. And the financial bottom line is basically directed to people who are planners, a technocratic audience, including finance minister. The equity bottom line is one that is going to be relevant to people who are more concerned about questions of equality and social justice. Next, the next bottom line is about durability and sustainability. And so here you have get the attention of people who want to take a long-term view and who want to think how their country is going to look half a century, a full century down the line. And then the final bottom line that I would suggest we pay attention to is the demand. The question has been often raised, is there really a demand for family planning services? And my answer here is that there's actually a demand, especially if you begin to return to what I think is the fuller and literal understanding of what family planning is. I would argue that if we take the position that family planning is not just about planning birth, then there's a tremendous demand currently among the youth of Africa. And I'm going to show you a picture that basically is a slight indication of what I'm talking about. So this is basically what I'm going to say, and I'm just going to take you through these 3 points and take them one at a time. Next slide. And so this is an example of a laundry list, which Rhonda Smith and all the folks at PRB are going to recognize. And this is just a list on the health benefits of family planning. So you can see that if we took not just health, but also education, equity, poverty, gender, the list of benefits is going to just increase exponentially. And so it's very nice to have lists. Next, there are many benefits from having a very extensive list, because this draws attention to the many benefits, the many dimensions, the many ways in which family planning can be effective or useful. But next, there's also a risk. The risk is that what I may call sort of the spaghetti against the wall problem, which is to say, if we just throw all of these arguments to the audience, then it's really hard to anticipate what it is that they're going to see, what it is that they're going to remember, and what they're going to get from our messaging. Next. And so instead of, or rather in addition to the laundry list, I suggest we pay attention to sort of a few targeted bottom lines. And I'm going to just run you through a few of the bottom lines that I had in mind and giving you a little bit more detail. These are the bottom lines I had in mind. And we can start with the very first, which I'm not going to spend a lot of time on. And you've had an example of this. For instance, the PRB in its population family planning saving lives sort of classic takes people through the savings that they're going to achieve with each dollar that is invested in family planning. And so from the standpoint of a planner or financial person, just this bottom line is enough to convey the message. You just get the point, and then you can return to the detail later, but you just see what the savings are. Similarly, Marlene's presentation on the dividend did an equally good job in thinking about the benefit in terms of fiscal space, in terms of growth that you can achieve if you invested in family planning. So focusing on the financial bottom line for this particular audience, for me, is going to be more effective from a communication standpoint. A second bottom line, next, is what I call the equity bottom line, and which is of concern for those who are interested in the distribution of the benefits of family planning, the distribution of the benefits from dividends. And as Marlene said, the benefits from dividends are far from automatic. They're not automatic because you have what I call, next, a perfect storm of inequality. You have three fundamental sources of inequality that really come together. Inequalities within family in terms of the fertility level, and this is what the chart on the left is supposed to represent. But you add this fertility inequality to massive income inequalities that are actually underestimated in the case of Africa. And you also have inequality in family structure, meaning not only just as adverse family structure, but also families in which mothers have relatively little control over how money is spent. So the accumulation of all this inequality translate next into very large inequality among children, and next, they would lead to even wider, larger inequalities in the next generation. And so the picture to me and to those who are interested in or concerned about inequality is not rosy, and family planning can play a very, very important role in breaking this intergenerational cycle in the reproduction of inequality. The third argument, next, is what is I call the durability, sustainability argument. And the idea here, I wish I could see the PowerPoint. The idea here is that the effect of the benefits from family planning, and especially if you think about the dividend, the benefit that are generated from the dividend, are not short-term. They can actually, if they materialize, they can extend over a long period of time. You have a cascade or potential succession of three different dividends, the first being what is called the first dividend, that it can be a short-term, next. Then you have next a second dividend that is the result of the spending of the first generation that reaches retirement having spent enough to provide for themselves and maybe consume, leads you to a second dividend. And then next, you have a version of the third dividend, which is related to the investment that Marlene talked about in the human capital of the early childhood development of the current generation of children. And so the piling or the succession of these three dividends means that you can actually start a process that is going to be sustained in a relatively long term. And for those who are interested, who have a long-term vision, this is a very appealing possibility. The final bottom line, which I would suggest we pay attention, is the demand. And again, the question is whether there's a demand for family planning. And my short answer is that there is actually a very large demand for family planning among youth if we return to the full meaning of family planning, which is not about just planning birth, but about planning lives and planning families. And planning families, especially for youth, African youth today, who are very concerned about their future, is to think about how they plan their transition into the world of work, what kind of skills they need to have additionally, how to build connections, how to maintain their skills, how to market themselves, et cetera, how to build leadership qualities, entrepreneurship, et cetera. So there's room there to incorporate family planning in a large vision, which is concerned about planning futures, planning families, literally, and planning lives. And so I end with this picture that was taken actually last week is part of the project. Next, final picture. This is a picture that I took, that was taken last week in Cameroon as part of a project that is funded by the State Department on the youth bulge in sub-Saharan Africa. And so as part of this project, we give about 100 youth the opportunity to participate in a summer internship to learn precisely these planning skills, including family planning, but many other things about budgeting, leadership, communication, etc., just a wide range of skills. And we were literally mobbed. You know, there was such a high demand for this kind of training that we had to set up a very rigorous selection process. And so to me, it was a clear indication that among these youth, there's a great concern, there's a great commitment about thinking, planning for their future. And family planning is part of it, but it's not the entire picture. And so if we really want to raise the visibility, the demand, and the response, we have to come closer to embracing this broader vision that the youth share. And so I'll stop there.
Great. Thank you, Parfait, for really wrapping it up. We're going to turn it over to questions in just 1 minute, but I'm just going to open it up, let myself ask one question, and anyone in the group can answer. We've heard a lot of positive things about what family planning can do, how the demographic dividend can be a positive thing. But I sense that in Africa, it's really not been that positive. I personally just came back from Nigeria, where 62% of the population is under 24. The place is really much worse than it was in 1970 when I lived there. So can someone give me some positive things that are happening population-wise in Africa? Any of the panelists? And is the demographic dividend really going to work in Africa, given corruption, inequality? Want to take it away, Jay?
Sure. So I think there are a lot of positive things going on with respect to family planning in Africa. For example, Malawi, which is really a very poor country, has a modern contraceptive prevalence rate of 46%. That's tremendous. I think there's plenty of opportunity to continue to see increases in the uptake of family planning, say in West Africa. But I think that we're seeing, lots of increases that we haven't seen in a long time. I think, things like Family Planning 2020, advanced family planning, a lot of things that are kind of coming to a head, building capacity and making the case for, changing the way people think about family planning and trying to engage traditional leaders, parliamentarians, et cetera. So, is it going to change overnight? Certainly not. But we are seeing, I think, changes that look positive. I think
Marlene's got her hand up. Marlene, jump in here.
I think from the perspective of family planning that there is a lot positive going on in terms of declining fertility rates in a number of African countries. But while family planning may have a lot of positive impact, it's not the be-all and end-all. And also, because we're talking about populations, it's a long-term perspective to see the effect of a fertility decline now. So what you're seeing in terms of large cohorts that are unemployed is about past fertility and failure to invest in anticipation of those children becoming workers. And admittedly, this is a tough problem. It's not saying failure, somebody didn't think about it, but it's a tough problem in limited resource environments.
Let me ask the panel here. Is it true that the fertility rates in Africa, it's terrible to talk about Africa because it's so varied, but for simplicity here, and perhaps you'll want to detail it. The fertility rates in Africa have not decreased as in response to some of the other improvements, per capita income, child mortality, women's education, which still have huge problems, but haven't decreased in response to those improvements as they have in some other parts of the world. Is that true? I mean, and if it is, how do we need to do things differently? I'm impressed, by the way, at the depth of technical analysis and work that's being done, which is is very helpful. But as you've all recognized, it's kind of a speak to the finance ministers and other technocrats and health ministers. It's not a speak to the population. But is that in?
Can anyone answer that question? Is that true?
You know, we did some analysis in Malawi a couple of years ago looking at, given its contraceptive prevalence rate, why is fertility not
decreasing?
Yeah, I mean, it's decreased, but it's not
Right.
where you would expect it to be if you compared it to other countries and looked at proximate determinants. And, you know, yes, we came up with methodological reasons, but I have to say it's not a very satisfying answer. I mean, there are other factors
Because
at play.
it does not, the fertility rates haven't responded to
Exactly.
circumstances they have in other parts of the world. They've gone
dropped,
down, but they haven't responded
Exactly.
fully.
Not quite as much.
I think this is really a key question. I think of
I go to the audience.
Latin America, for example, where one of the more effective things we did in Mexico with the sitcoms. I love the last slide that said, where's the demand? In some ways, I almost wish that had been the first slide, because it was demand that shifted in Latin America. Those sitcoms are just great. And we've got so much more access to information technology today. I don't know, that was a key question. I keep
Also
on
in
asking.
Mexico, one of the things they did was once they started getting oil money, they invested in a rural healthcare system. And one of the main reasons for it was to provide family planning, because they recognized the links between fertility and development, especially in rural areas. So
I loved your charts about the impact of, on the various other goals.
On the various sectors.
A better family, a stronger family planning. But of course, as I know you thought a lot about, there's a feedback.
right.
The better health care we can have, the stronger the family planning.
And better
It goes-
education. I mean, it's all related.
I remember when we looked at family planning, we looked at population per children per family in this country. Back in the 80s, there was a study done in Tennessee that showed that once women had more than a third grade education, this went back a long time ago, that's when they began to have fewer children.
Great. You know what I'd like to do? I'd like to go to the audience. We have a lot of experts. You're first, and identify yourself, please.
Jeff Jordan, PRB, and panel, thank you. It was a very, very rich and wonderful discussion. I wanted to throw out something. You threw out the word corruption at the end. The word justice came up parfait in yours, and I thought it was going to take a slightly different run, and it fits throughout the equity question, and it fits throughout women's empowerment. And there's a certain level of assumption that you have some level of rule of law, that you have some access to sane systems, whether those are legislative systems that are going to allow for finance and other kinds of things to happen. So I just asked the panel, a lot of this deals with how individuals react to things and whether or not they have access to services. But there's a whole layer in this that we are making assumptions about. Is policy effective, and where is it effective? Is rule of law playing out so that people have access to the kinds of things for empowerment or for individual rights and other kinds of things? So
let's let Marlene take that. Marlene, you wanna give it a go here? Did you look at it all, the sort of the general environment, the political environment You're not talking about the United States now, I hope.
Actually, I don't have it off the top of my head, but there's a lot of work that's going on around accountability and trustworthiness of governments and corruption. And my recollection of the most recent work on that is that there is progress. Of course, it's differential progress across countries. And one of the things that we really don't know that well is what happens when you have the abrupt end of rule of law and a significant shift. Sometimes it doesn't always, it's not always as disadvantaged as we think, because the rule of law may actually be putting in place more strict, enforced, you will follow these directives. I'm sorry, it's not a complete answer because I don't have that off.
Jocelyn, maybe I thought it fascinating. What role are private sector entities playing in this fight, if we want to call it that? I mean, your organization, obviously, do you have a sort of a broader perspective other than just your organization, which sounds like it's doing fabulous work, and maybe we'll move to Africa next?
Yeah, I mean, we're talking about discriminatory policies, policy frameworks, I think are very important. I think even in the private sector perspective, trying to think about how to support families and women in economic empowerment, there's a policy framework. We have policies that are in place within the company, but then there's culture. So we have things that say, men should take 2 weeks paternity leave, and they don't take it. So, I think when you're looking at any of these questions, it's also about culture and continuing to have conversations, for men getting involved in conversations about equity and about family planning and other things as well. So I think, certainly the policy and legislative pieces are key, but then you have to also have conversations and have cultural shift as well. So
Let me just go to the audience. Let's go to the back there. I promised you an hour of questions, and I'm not sure we're going to get that.
Hi, everybody. My name's Trisha Petruni, and I work at Pathfinder International. Thank you for all the presentations. I have a question for you, Parfait, on your durability bottom line. Something I think we've been struggling with as the choir is the sort of human nature of politics to invest in things you're going to see in the short term. We tend to keep talking about things that we'll see the social and economic benefits of this stuff in 2050 or even later. Most decision makers in Africa tend to be a little bit old. They want to see something that they'll get credit for, not only before the next election cycle, but in their lifetime. So I'm just wondering if you can point us to some of the visionary leaders who might be more receptive to these sort of longer term aspirations.
Great question.
Well, it's a really great question, and I thank you for it. And I can try to tie it to the first the question about corruption and the question about sort of taking the flip side of the positive. I mean, somebody, I think it was McPherson, who raised the question about, we emphasize the positive, but we have to pay a bit of attention to the roadblocks. And one of the roadblocks that I see is not so much, from my perspective, is not so much corruption as it is what I call bureaucratic inertia. That is, Africa is in a position where many African countries, I'd say, are in a position where they can draw useful lessons from a wide pool of experiences, where they could be opportunistic and draw on new partnerships, find creative solutions. But you have to have institutions and actually champions in place that actually can not only think these solutions, test them out, and bring them up to scale. And that's actually a missing, in my view, a missing piece. Now, as far as durability and folks who are willing to see the big picture, they can be found across all sectors of society. I've met a few parliamentarians in some of the work that I've done under the aegis of the Hewlett Foundation across a number of countries in Africa. They may not necessarily be in a position to make the change alone, but you do have among parliamentarians and even in civil society. As I speak, there's sort of a network of journalists who in Cameroon who organize themselves and using their own means to push this agenda on reproductive health, women and family planning, and what the implications are for economic development. They don't really have a lot of resources, but I've been just surprised by their level of commitment and their willingness to think ahead. So you find them sort of across the board, but they kind of scattered, and they don't necessarily always have the leverage to bring these changes to the highest level, I'd say.
Okay, I think you right here.
It's funny, we're all asking questions on the same sort of theme.
Identify yourself, please.
I'm Lori Krieger I work at the Manoff Group. And I wanted to also thank you all for the wonderful talks. I wonder, I kept thinking until Dr. Alundu Anyege's talk that no one is mentioning social class, which is really important throughout the world, not just in Africa. There's so much structural inequality, not just based on gender in the world, that affects maternal and child health and family planning rates. We see it in the United States. So do you think there could be a stopping point unless structural inequalities are dealt with, and will they ever be dealt with?
Jay? Go ahead. Well, let Jay and then go ahead, chime in.
I think that these are major issues, and I'm pleased that we push on them in so many ways in our foreign aid program. I think that we can get improvements even without in that context, but certainly the family planning, the health and safety in women, the safety of women and children is going to be improved by a whole lot of things. But we can't stop on the family planning only until we get all the stuff other improved. And I would make one last thing about the private sector. We should not think about this only as government.
I agree. That's why I was happy to see the Merck presentation.
Right, it's excellent. But I look at social marketing in these countries. I remember in Bangladesh, it was done such a great job, looking at these little tin stores and little villages where they had ORT, they had condoms. The social marketing is important here.
You want to take a stab at whether we're going to end social inequality in the world?
Sure.
Okay, go ahead, Jay, and then we'll go to Parfait.
That's a hard question to answer. I'd say there's a lot more emphasis on gender, addressing gender. And like today, there's the plenary of the Interagency Gender Working Group. I think that on the demographic dividend, until things like gender are addressed, so to create economic opportunities for women, better control of their own fertility, nothing is going to change. I mean, this demographic dividend will remain a pipe dream. But at the same time, equity issues have to be addressed, and I think they are much more difficult because of geographies and cultural norms. Totally, yeah.
Parfait, you want to jump in on that one? Or did you have
Yes, absolutely. And I'm so glad this question is being raised. This is a difficult question, but it's really one that is fundamentally important to address. And to me, that's the most, the thing that really keeps me awake at night. The staggering class or socioeconomic inequality that you find rising now are under discussed. If you just look at the school system and you look at the massive differences in access and the quality of education, you just have to visit schools and see how this inequalities is building. And every single place I look, every time I return, I see really no end in sight. I see things as moving ahead. And this is particularly risky and dangerous because, as you all know, late adolescence and young adulthood is a time of great volatility. It's a time when people make a lot of decisions that are going to have a long-term impact for their lives and the lives of their family. And so unless you solve this equation of class differences and inequality, especially along this age group, I'm glad that Woodrow Wilson has and the PRB also have increasingly looked at the security question. You're going to have just reasons to worry about security. And it's not security on a dramatic scale. When we talk about security, most people tend to think terrorism. That's not the only piece of the equation. You just have a lot of lower grade forms of security that are equally worthy of concern and that are going to make life difficult for everybody in the region.
Okay, more questions. Right over here.
Hello, everybody. My name is Jalil Brown. I'm a Field and Outreach Fellow at Population Connection. My question was revolving around life planning and just how that basically I do see the significance, of course, of everything related to the fertility rates and things such as that. But I do think that the broader perspective of focusing on life planning is often, at least one thing that I've seen like in my community and just in like my own research, I've seen like kind of that broader perspective and that broader approach as one that does have more impact. And it also, like you said, it taps into that demand from the youth and from more people that can actually relate to it and can kind of see how that will affect their life in more ways than just, you know, whether or not they'll be able to plan their pregnancies. So I wanted to ask, I don't know how deep into the life planning project you are, Parfait, but I wanted to ask if like how that was going and kind of what other aspects of the life planning project outside of family planning is like are the focus, and what are the impacts, if there has been impacts already, what are the impacts of the life planning project?
I think to rephrase, I mean, I think what you're asking is to what degree is there an investment in helping young people plan their lives in a general way rather than just like don't get pregnant. Parfait, you want to jump on that?
Yes, there's precious little. You have containment solutions, creating youth center where you can sort of, I wouldn't say entertain, but at least occupy them a little bit. There's a big demand. My project itself is in its very early stages, and I would be happy to keep you informed about how it unfolds. Basically, in addition to planning births and fertility planning and so forth, we're just looking at sort of the overall future planning mindset, thinking about financial planning, budgeting, thinking about building new skills, thinking about health management, thinking about leadership and communication skills, thinking about community service and all these pieces. How do you build your network, build your social capital, and so forth? And so what we want to do, we are fortunate that we have a Ministry of Youth that seems to be receptive. What we'd like to do is just test some of these initiatives on a small scale, and then see places where there's a strong response, and just do some kind of cost-benefit analysis and make recommendations, and hope that both the public sector and maybe some of the private actors are going to follow through. And so we're very excited about it, but it's in the early stages.
Great. Okay, in way in the back there, and then we'll go to you.
Thank you. I'm Dave Rabinowitz. I'm retired. And a few years ago in Brazil, in that region, there was a surprising reduction in birth rate. And they found it was attributed to telenovelas, basically soap operas. Peter made a reference to sitcoms in Mexico. And basically, this provided role models for the people. The major characters were wealthy, and had small families, and they became role models. We've seen similar things in the U.S. relative to the attitudes towards homosexuality and TV shows and such. I'm wondering, is anybody actually working on developing TV and or radio series which provide role models that not only provide motivation, but also show in detail how you go about achieving this kind of family planning?
I'm going to let you, looks like you got some answers. I'll just briefly answer. I work with media in Africa, and there's been some very successful telenovelas and sitcoms dealing with HIV/AIDS, and very, very successful. I don't know about the family planning part. I would say that there might be some cultural issues, as Jocelyn said, relating to some of these family planning things. Go ahead. Could I identify yourself?
Sure. I'm Bob Walker with the Population Institute. Our organization actually worked many years ago with Miguel Sabito in Mexico to develop those telenovelas. And Miguel Sabito was taken by our organization also to Brazil, to India, and other places. And out of that activity was spun off an organization that's now known today as the Population Media Center, which is our affiliate. And they've had tremendous success in using
In Africa?
long-running serial dramas in Africa, but also in Asia and also in Latin America. I'll give you one example. They ran a program recently, a 2-year soap opera in northern Nigeria in 5 states. After the program ran, they did extensive surveys at family planning clinics in those 5 states.
Great.
And they found that when people were asked why they came in for the first time to the clinic, 2/3 of them said Ruandare, which was the name of our program.
Fabulous. Well, that's a great, I'd love to see some more stories about that. That's a great model. There was another person right in the back there. Recognize Ben?
Yeah.
Hi, Ben.
Ben Barber, formerly editor of Frontlines at USAID, and since then writing for Huffington Post. Is the current U.S. administration cutting money for family planning or maintaining it? And what is the relationship between fertility and migration, illegal migration?
Great questions. Can anybody answer that? I cannot. Anybody in the audience? Jay, do you know the numbers, the budget numbers? Do you,
Not off the top of my head.
Okay.
I think Congress has kept the administration's cut from becoming in effect.
Okay.
The administration zeroed out family planning 2 years in a row. It's Congress that has.
Okay, so basically the money has not been cut so far.
Well, it's been flatlined.
Okay.
There's been no increases at all.
Go ahead, let him give the mic, yeah. Sorry, you want to just repeat what you said?
Just the basic, we're still in continuing resolution. The administration has twice zeroed out, well, actually once zeroed out family planning. The second year, they put out a smaller number, but much lower than what it is. It's Congress who has maintained the funding, but it's been flatlined for the last few years, and we're coming back into another kind of continuing resolution moment now. So, so yes, the administration has not been a friend to family planning, but Congress has maintained that that line.
Great. Okay, second question. Anybody have the answer to Ben's other question? Is there any rate between migration and fertility? Anybody know that? Marlene?
I know that most migration.
Talking to the mic, please.
Sorry. Most migration is chain migration, so there is some subtle link, just if you have more relatives out there, but I haven't seen anything that says migrants come from higher fertility countries or anything like that. Yeah.
Okay. More questions? Right here in the back, the lady with the hair back.
Diane Seeger, retired. In Africa, someone had mentioned that ages 15 through 64, at some point they want to have 1 million jobs a month, and there's pressure on rural markets. What kind of jobs would those be that they're planning, and what kind of skills are they planning to help these people have to take on these jobs?
I think that was Marlene's figure. Go ahead, take it, Marlene.
That was my figure, and it actually, the number is staggering to deal with. There are varying approaches. One of the, I would say, popular is not the right word, but prevalent approaches right now is to think about building on the types of jobs that you can actually create as an entrepreneur in Africa. So it's going to be more livelihood strategies where during this season you're selling pencils to the school children, and maybe in another season you have something else you're selling, or maybe there's enough demand to have lots of hairdressers. And those, you notice, are mostly urban type of activities. So a lot of the challenge is how do you create jobs or increase agricultural productivity to sustain more people in rural areas. There are investments in training young people for more modern jobs like information technology types of jobs, but those are not going to rise to the level of numbers we're talking about here. John, something?
I think there's a close relationship between fertility rates and health on one hand and economic growth on the other. I think by and large, those two or three communities don't fully appreciate each other. The economic growth community, we needs to be more supportive and understand how health and fertility fits into economic growth. And honestly, the fertility, family planning, and health people need to be more interested and supportive of economic growth.
Go ahead. Why don't you grab that mic right there?
Thank you. John May, Georgetown University. Thanks to the panel for a very rich conversation. One of the major stumbling blocks in Africa today is the lack of commitments of the leadership. So what do you suggest we do? This is a question to the panel.
Yeah, this is another one. How are we going to solve global inequality, and how are we going to get rid of bad leaders in Africa?
That was a slightly different question. That was lack of commitment of the leadership. And
take the mic, if you would.
I have been privy to some pretty negative conversations about what we try to do. And I actually think that extending this idea that PRB has in terms of advocacy, in terms of policy champions, to a broader sets of people that we don't involve now, the influence of the South to South, Korean demographers talking about Korea and their experience as opposed to American demographers talking about the Korean experience. That actually carries a lot more weight these days with maybe not the Prime Minister or the President, but at least with the economic development people and the ministers of health. So I really think building out our champions who can speak to their own experience and speak to African leadership now.
You guys have any other, Jocelyn or Jay, any other comments on how to? Parfait. Oh, Parfait, sorry, go for it.
No, I just meant, I think we also have to think hard about motivations. In the conversation that I had, and I agree with Marlene, that occasionally you run into a fairly adversarial conversation and communication. But there are questions that people, even if they're slow on the take, begin to notice and to realize, just the stress on the job markets, the schools, and the crowding of it. There are a few tangible problems that are emerging and that the leadership is beginning to recognize. And so you have to be, and this is why I was speaking about nimbleness, just have system to have an ongoing conversation. if you start the conversation in terms of family planning, births, and so forth, there's almost a knee-jerk reaction, sometimes uninformed. But if you start from the perspective of some of the development questions that preoccupy them on a daily basis, then you can steer the conversation in directions that are more productive.
Great, Jack, go ahead.
So I think that's a really good question, John, because when it's a group of family planning people, it doesn't matter what the question is. Family planning is always part of the answer. And I think that the demographic dividend, for example, got picked up by family planning advocates because it was a way to get people outside of the health sector to say, oh, this stuff isn't so bad after all. It's going to help us get wealthier. And so I think that the movement hasn't been fast enough in terms of the economic growth or the change in the population structure. I think there's a tremendous misunderstanding of what the demographic dividend is. People think, got a young population, ka-ching, we're going to cash in and be wealthy, without understanding that that is the clay through which a demographic dividend is sculpted, and also not understanding that it's the economic policies, the governance, the gender, everything else. It is not just human capital. So, it's a complicated situation, and I think in some ways we've done ourselves a disservice by not fully explaining it. I think so much of our attention has focused on the family planning population side of things without getting into a lot of the more subtle things that are outside of our areas of expertise related to the economy and governance.
Regulation. Right there in the back.
Thank you, Roy Jacobstein, IntraHealth International. Since you wanted these posed as questions, I'll say, how does the panel feel about some of these additional facts that I would like to mention? The reason is there's been a slight negativity about, quote, Africa. And I want to remind ourselves that, first of all, Africa is doing very well in contraception. East Africa is doing remarkably well. Zimbabwe has a contraceptive prevalence of 65. The U.S. is 70. Kenya is 60. Malawi, Jay, is actually 58 in the latest survey. Okay. So, and then remember that urban fertility and urban contraceptive use is much higher than rural, and Africa's urbanizing at 5% a year. So there are many positive megatrends that will predictably drive further increased interest in contraception. Men's and women's fertility intentions are becoming more similar. When you actually look at the data on contraceptive use in, say, the PMA 2020 surveys, there's a fairly equitable use of the methods that are driving increased uptake. So there are a lot of positive things in the horizon that if we came at this more from the data on contraceptive use, we might see more readily than some of the comments have spoken to. So I just wanted to put that out there and ask if
Thank you. No, that's very helpful. And I don't really mean, I hope it hasn't been a, dump on Africa.
No, but it wasn't a
because,
dump. But I mean, when my old boss way up the chain, Mr. McPherson, asked about, is Africa different? And so the demand is there, and it's increasingly going to be there.
Thank you. All right.
Do I get to respond as
Sure, go ahead. Let's go. Then we'll go. Do you have someone else?
He's a very smart guy, so I need to listen to him. But I hope that I'd like to think that's right, and you know the data, you're closer to it, I'm sure, than I am. I wonder, now, the Kenyan numbers haven't moved much, despite the high prevalence.
They had leveled off for a while, and now they've gone up.
The fertility numbers?
Well, no, but remember, prevalence goes up before fertility goes down often, sure, especially when it's going up in such a fast time.
Okay.
So,
okay, so
the prevalence,
point being
like
that
in 2008, the prevalence was 40%. Now it's 60%. Ethiopia has tripled in 8 or 9 years. Burkina Faso, I mean,
I think this discussion we need to set a date 5 years from now and come back on this date and examine the data, because I think that's what you're saying is we're about to see some real changes. Okay, more questions. Right here.
Thank you. My name is Deborah Dekvile, and thank you very much for your comment. I guess for me, it did feel like a dump on Africa session after a certain point. So I only just have a few comments. I'll try and make them questions, really. But
questions, please.
Yes, I'll try. So I just wanted to say that, first of all, I think we need to approach this with a little bit more humility than we are currently when we talk, African leaders, they don't want to commit. They don't, have to be a little bit careful about that and address the elephant in the room, which is culture and the source of
good point.
all of this. So always have to bear that in mind. These are not just a bunch of irrational people, who, and there are also multiple commitments. And looking at the problem from different angles, thinking, well, even the debate over which comes first, economic growth or, reduced family size, that's still, there's still a bit of a chicken and egg debate out there. So just to, throw that out.
Question?
And then the question. So it's just a minor question. So I was just going back to the issue of social class and wondering about the data. I think this probably already been addressed a little bit in the last response. But I was just curious how much detailed look at class at different social classes is carried out when looking at fertility rates, because I would imagine there's a huge difference. You can't lump rural and urban in altogether.
Right, good point. Does anyone, Jay, or does PRB have any data of that nature, Marlene? In other words, looking at fertility rates among the different classes.
Yes, we do have the data. We have actually published some of that, and it, generally speaking, it is what you would expect, that you would, well, actually now I have to say it isn't what you would expect sometimes. It does vary, because there are some places where what you would expect does happen, and you have higher fertility rates in the rural areas. But Jay, can you think of an example where we've got higher fertility rates in the urban areas? Because I was just speaking with some folks at NORAD, and they were concerned about urban fertility rates. I'm trying to think of what country it was, though.
Yeah, I can't think of anything where that would be the pattern.
Yeah.
Oh,
yeah, Parfait.
No, it's just to appreciate the call for nuance and moderation, but also to indicate that if by class you mean wealth quintiles, you actually can have very easy access with to this information with online material that is offered by the USAID stat compiler. And the data, part of which I showed on my slide, just shows systematically in terms of wealth quintile, just you have large differences between the top and bottom wealth quintiles. In some countries, actually exceeding 3 births on average per woman, which is a large number. But in most cases, it's typically over two children per woman of a difference, between the top and bottom quintile. And so these are large differences. And there's a little bit of evidence, and I have I wrote a paper sort of out of the PRB suggesting that as countries begin their transition, these gaps actually they increase first before eventually tapering off. So there are large differences just based on wealth. Now you can do additional breakdowns if you want to look specifically at rural urban and the rural poor versus urban poor and so forth, but it's easy to have this sort of the basic summary data online.
Okay, Marlene's giving me the sign here. I think we're at 11:30. This has been really fun, and I really, Deborah, that's you, Deborah, I appreciate your comment about culture. I think this is probably a whole nother discussion, so maybe Megan will have another 2-hour panel next month. I really enjoyed this. Thank you all, and Megan will wrap it up.
Thank you all very much. Thank you all for coming. And Just want to say I love that we ended on the note about the importance of nuance. Thank you, Parfait, because I do think that is incredibly important in everything that we do, and we don't often have the time to get to this level of nuance. So I appreciate you spending the time, taking the time to do that here today. And of course, there's much more to dig into. All of the resources that the panelists mentioned are online on their organization sites. We will be posting the PowerPoints on our website if you want to look more closely at the charts. I'd also encourage you to check out the new Security Beat, which is our daily online platform. And just today, we published 2 articles related to this, one on contraception agency and women's economic empowerment that you can pick up outside, as well as the first in a new series of a partnership that we have with Apolitical about caregiving and women's economic empowerment. Copies of those are beyond. So now, but before you leave, please join me in giving a big thank you to our panel, and to our moderator, and to our keynote.